So today we're going to show you how to properly identify your patient and do a phlebotomy procedure on your patient. So the first thing that you do is you introduce yourself and you identify your patients with two patient identifiers. How you doing? My name is Miss Beverly. I'm coming to our labs. Is that okay?
Yes.
And can you please state your name and date of birth?
Yvonne Anderson, 2/14/1962.
Okay, and then you just make sure that you're looking at your requisition to make sure that the name that she's stating matches on the requisition. So the first thing you do is put your gloves on. And whatever lab that the physician ordered, you get the correct tube. And my physician is ordering a CBC, which is the lavender. So now we tie your tourniquet 3 to 4 inches above where you're going to stick, and this is the anticubic space where your 3 veins are located. The first vein of choice is the median cubital vein, the second vein of choice is the cephalic, and then the third vein is the basilic. Now you just want to palpate on your patient's arm. Palpate means to feel. So you want to feel something that's bouncy and squishy, just like a sponge. Guess that you have something right here. So now you want to release your tourniquet, because the tourniquet can be on no longer than 1 minute. So at this time you can assemble your surprise. This is the Eclipse needle, which is the 22 gauge, and then this here is a vacutainer. And then we're going to clean our venipuncture site with alcohol. You can either do one swipe away from where you want to stick, or you can do the concentric circles. It just depends on where you work. So I'm going to do just the one swipe. You let it air dry, you don't fan it, you don't blow on it, you just let it air dry for the alcohol to be effective. And you always want to have your supplies close to you so you don't have to cross over the patient. You're going to make sure that you look at the needle to make sure they don't have any defects, and make sure that you stick with the bevel up. All you're going to do is anchor your vein 1 to 2 inches below where you're going to stick. On a count of 3, I'm going to give you a little stick, okay? 1, 2, 3. And then the blood automatically fills up because they have a suction in the blood collection tube. So that way you know when to take the tube out. You never want to underfill it because it may be rejected in the lab. And then once you stick the needle in, you make sure that the vacutainer is tight against the patient's arm to prevent movement of the needle. You invert. 1, 2, 3, 4. Alright? You put it down, you release your tourniquet. Make sure the tourniquet is off before the needle comes out. You place the gauze on top with no pressure. You release, apply pressure, safety device. Now you're going to ask your patient to hold at least 3 to 5 minutes for the bleeding to actually stop. So can you hold 3 to 5 minutes? And then while they're doing that, you can write on your label. Now, if you don't have a label, then you would have to put the patient's name, date of birth, time, medical record number, and your initials. But if it has a label, you just take the label and put it on the tube, and then all you would have to physically write is your initials and then the time. And remember, the time is in military time. So now you can check out patient. Okay, and we're checking for any bleeding or a hematoma. And if the patient is still bleeding, you just apply more pressure to the
What
side.
is a hematoma?
A hematoma is a accumulation of blood that's leaking under the skin. It happens sometimes when you infiltrate goes through the needle and the blood just pools in one spot and it makes a lump over the skin. So now you have your biohazard bag. Put it in your biohazard bag. And the requisition goes along with this, and then you bring it to the lab. You have a great day, Miss Yvonne.
Thank you.
And the doctor will call you as soon as the results come in.
All right.